So it's quite exciting because the BSH have got a new working group, and it's a genomics working group. So it's got a few people together who are interested in and currently work on genomics. And the idea is really to try and make that clearer to people who are going to be using more genomics and getting reports on genomics for their own patients. So the idea of the working group is to try and educate people, but we're really keen to find out how people want to be educated. So part of the idea of the welcome breakfast is to give us some information, but also for people to tell us what they'd like us to do to help them. So the actual welcome breakfast table is going to be quite hands-on. I've brought some reports people can have a look at, and I've got some activities for people to actually try and understand when they see a mutation, is that pathogenic, is that not pathogenic, and how can you tell? And why is it sometimes that the results are not as clear-cut as they'd like them to be? At the table, we're going to have some hands-on activities for people to really see, first of all, what a report looks like, so they can ask us some questions about the reports, and also some hands-on activities where they can try and understand for themselves whether a variant is pathogenic or not, so whether it's disease-causing or not. And also, we'd like to try and explain why sometimes the reports people get back are not as clear and straightforward as they might hope to be. In haematology, we know that eventually, like for a lot of conditions, all patients are going to have access to whole genome sequencing. And that will be really important for making some diagnoses, but also for making some treatment plans, for giving patients some prognosis, and for really tailoring the treatment that we give to a patient to their particular condition. Between now and then, how we get to that stage is a little bit complicated, and we have a few interim steps that we're working through at the moment. So as far as a hematologist is concerned, they will have to get used to seeing different types of involvement with genomics. So for example, we will be doing more targeted panels for the next few years, and then we'll be moving on to whole genome sequencing. I was very pleased to be selected last year to go to Cairo with the scheme, and the idea was that I would be able to go there and give a talk at a conference. So I gave a talk at the Egyptian Society of Haematology. I gave a talk on dyserythropoiesis, which was quite nice because it covered both malignant and non-malignant aspects of haematology. But what was more important is that I got to set up a relationship with the clinicians there. So they took me around their hospital, and it was a really humbling experience. I got to see the amazing work that they do there with really limited resources. And we were able to discuss cases, so that they're going to send some cases to the UK for analysis, and we're going to talk about doing a research project together. And they've also invited me since to go back, which I'm going in a few weeks, and give another talk on thalassemia. So it's been really good that with this scheme, I was able not only just to go for that one occasion, but to really set up something that's still in the early stages, but hopefully is going to grow with time.